Next page. Acute laryngeal tracheal bronchitis is another fancy word for croup. And you want to make sure you write that. Oh, it's already written, highlighted. This is viral. Put this down, this is a big deal. We treat this virus with racemic, epinephrine through a nebulizer. Racemic, epinephrine through the nebulizer. We do basic care and comfort with saline drops in the nose, bulb suction before feeds, and at night, the mouth first, then the nose. This child is kept at home unless they have a respiratory song. And as they're kept at home, where do we take them? Outside in cool weather. Take them outside in the cool weather. Remember, they have inspiratory stridor, so highlight that. Highlight inspiratory stridor on the left-hand side. Highlight where it says upper respiratory infection frequently preceded it on the right-hand side. They usually start with a cold. Highlight where it says before age 5. Remember to put this, it's the weirdest, stupidest shit I've ever seen. Positive steeple sign on X-ray. Remember, we have all these X-ray craziness. Steeple sign is on the X-ray. This is a barking cough. That's what it sounds like. Crows and barking and seals and crazy. All night long, it's worse at night. Now on the bottom, put this, RSV, and you already know it. What kind of precautions is it? No, you're not. Contact until it's treated with ribavirin, then it's airborne. I want you to write everything I just said. RSV is contact precautions until treated with ribavirin aerosol. So we treat this with ribavirin aerosol. And because it's an aerosol, and because it's, spreading all the germs everywhere, ribavirin aerosol, we use airborne precautions when we treat it, and no pregnant nurse can give it. RSV. The person affected is babies, high-risk babies, premature, low birth weight. We do this in toe-to-toe. So low birth weight, premature. Next page. We're not doing this, so we're almost done. You know we're not doing this part. You took a picture of it, it's already in there. Broken development on this major, I gave it to you. This stuff is almost done. Okay, so anyway, otitis media. Gotta go backwards. Oh, really? Okay, there you go. All right, so anyway, otitis media, if you don't know this, you got a problem. This is an ear infection. Treat it with amoxicillin if, here's the big if, only if no improvement in 10 days. Only treat with amoxicillin. I said 10 days, I'm sorry, 2 days. Baby dead and stuff. baby went to heaven. 2 days, not 10. So 48 hours, basically. So do not treat with antibiotics immediately. We just really do antipyretics and analgesics. Most ear infections are viral. Again, treat with amoxicillin only if no improvement in 2 days. Okay. Now, when you give the patient antibiotics, we give them probiotics with it, don't we?
Yes.
Probiotics, antibiotics. The #1 risk factor for otitis media is what? Smoking. Secondhand smoke. Also adding to the problem is propping the baby to eat, propping the baby's bottle. Another risk factor is daycares. Another risk factor is pacifiers after 6 months. The risk is decreased if you breastfeed. Remember the reason why babies get this? And please write this down. Short, straight, less angled eustachian tube. Short, shorter, straighter, less angled eustachian tube. Shorter, straighter, less angled eustachian tube. In other words, adults, yours is more angled and not so short and straight. Theirs is very short and straight. And what is a eustachian tube? It's the tube that connects the ear to the throat. So when you feed this baby laying them down, you just fed their ears. When you prop this baby up, feed them, letting them just prop up a bottle, ridiculous. So you're feeding their ears. Going to bed with a bottle, feeding their ears. Very bad. Okay. Now, the thing about it is, if this baby has recurrent ear infections, hearing loss is a risk. If this baby has recurrent ear infections, hearing loss is a risk, so we put tubes in their ears. I think you have it at the bottom. It says myringotomy. Do y'all see it?
Yeah.
Myringotomy is tubes in the ears. Myring. Okay, so tubes in the ears. Myringotomy. You cannot let these tubes get wet, and your baby cannot swim, and they need earplugs at bath time. I'd be fussing at my daughter all the time when Bryce had this. So again, they can't get wet, no swimming, and they need earplugs at bath time. They naturally just fall out. The baby gets anesthesia to get them in, so that's scary. But the surgery takes all of 5 minutes. Very quick surgery. Tonsillectomy, you're going to have to write this in. Write it in at the bottom or the top, I don't care where. We don't do them anymore. They used to be the #1 child surgery, tonsillectomy. The reason why we did so many tonsillectomies is we had so many, strep throats. And we had so many strep throats because our parents all smoked. That was the only reason. So secondhand smoke equals strep throat. Frequent streptococcal infections equals tonsillectomy. Very dangerous surgery. We're lucky we didn't lose more kids than we did. Now, so we don't do tonsillectomy if we can avoid it now. It's the last resort if ever. So when we do a tonsillectomy, it is very risque. And consequently, if we have to do it on an adult, we're very, very good at our teaching. So you got to remember the very bad signs following a tonsillectomy, because my patient's sister was killed this way. So tonsillectomy patients, It's a oh my God if they have frequent clearing of their throat. It's an emergency if they have frequent clearing of their throat. It's an emergency if they have frequent swallowing. Remember when they come out of the operating room, they come out prone. No straws allowed. They need an ice collar. Cool liquids. Analgesics. It's okay if the back of their throat is actually white. That's no big deal. Okay. Now, just remember what we talk about in toe-to-toe. What's the two complications of strep throat? Glomerular nephritis and rheumatic heart. Now, on the, what's the next page? Hemophilia, we do that in hematology. What's the one after that? Duchenne. What's after that? Cleft palate. Oh, that's a good one. Okay, Kawasaki. On the Kawasaki disease, put at the top, everything is red. Everything is red. That's what you're going to write at the top. So look at that. Red hot fever, red tongue, red lips, red eyes, red heart. Color the heart in the middle of the shirt, red. So red hot, red tongue, y'all see it? Red cracked lips. If you go across the paper, red eyes, irritability, swollen lymph nodes. On the left-hand side, it says lymphadenopathy. I want you to add splenomegaly. Even the bottoms of the feet and the palms of the hand are red. What country is Kawasaki'S made in? Japan. Remember, this is common in Asian children. Japan, Asian. This is common in Asian children. I've had patients in my class that had children with it. Usually baby boys. Not always, but usually baby boys. Children under 4. Or I should say children under 5. It says it at the bottom, highlighted. So children under 5, just highlight that. The association of this condition is with carpet cleaning or new carpet. This is associated with carpet cleaning or new carpet. Never see them first, unless they have a respiratory sign. Never see them first. This will last for months. The most serious situation with the Kawasaki syndrome is the fact that this baby is forever at risk for cardiac complications. Highlight that on the right-hand side. They will need an echo, ECHO, periodically. They will need an echo periodically. Highlight the fancy $4 word on the left-hand side that says desquamate under skin, superficial skin layers, desquamate. This is what this means. I go like this and I pull off skin. Desquamation. Skin is just peeling. The treatment is IVIG, intravenous immunoglobulin. Please don't write that, just put IVIG. IVIG. That's what it is. Basic care and comfort, cool compresses, soft food, clear liquids. Antipyretics. This can recur, and the way you would know it is a fever. We believe it's autoimmune. Okay, put your celiac disease on this page at the bottom and put COMG packet. What kind of diet does a celiac disease child need? Gluten-free. On your exam it may say sprue diet, sprue diet. It says it right on your Oh My God packet. So a gluten-free diet, what do you teach? Read all labels. What happens to this child? Diarrhea and constipation, bloating, abdominal pain, weight loss, anemia, bloating, abdominal pain, weight loss, anemia. As an adult, arthritis. Complication of celiac disease is arthritis. How do we diagnose it? Stomach biopsy. We diagnose celiac disease through a stomach biopsy. We did leukemia in cancer. Scoliosis is 2 lines. Leave it on this page. Screen in 5th and 6th grade. Scoliosis, curvature of the spine. Screen it in 5th and 6th grade. Patient may complain of back pain, fatigue. They have to wear a Milwaukee brace for 23 hours out of 24, and it can't get it wet.